is Jesus Carroll. I'm going to be your student nurse today. I'm going to go ahead and wash my hands and put on gloves for CDC guideline. I'm going to go ahead and provide patient privacy. Can you go ahead and tell me your first and last name?
Maria Paula Gomez.
May you tell me your date of birth?
12/27/1995.
Maria Paula, do you know where you are?
Yes, I am at a hospital.
Do you know who the president is?
Yes, Joe Biden.
Do you know what's the current year?
2022.
Awesome. Patient is alert and conscious ×4. Maria Paula, do you have any allergies?
No.
And are you in any pain?
No.
Why are you here today?
Regular checkup.
And how are you feeling?
I'm feeling good.
Awesome. Patient's mood is alert and happy. Now, Maria Paula, I'm basically here to go ahead and perform a head-to-toe assessment on you. Now, during which time, at some point, I'm going to have to expose certain parts of your body. For the assessment, I'm basically asking for permission to go ahead and touch you during those times. Is that okay?
Yes.
Okay. Prior to starting my head-to-toe assessment, patient's vital signs were taken and vital signs are stable. Maria Paula, so I'm going to go ahead and touch your scalp. Is that okay?
Yes.
Patient has equal hair distribution. There's no infestations. Maria Paula, do you feel any tenderness?
No.
Any pain?
No.
Perfect. Now I'm going to go ahead and make my way down into the patient's ears. Patient's ears are symmetrical on both sides. Maria Paula, do you feel any tenderness?
No.
Any pain?
No.
Awesome. I'm going to go ahead and check the inside of both ears to check if there's any drainage or any impaction. No. Tympanic membrane is pearly gray. No drainage, no impaction. Again, tympanic is pearly gray. Alright, Maria Paula, so what I'm going to go ahead and do now is what we call here the whisper test. So essentially what I'm going to do is go ahead and cover one of your ears and then whisper something in the other one and you're going to repeat that back to me, okay?
Dog. Cat.
Now, I'm going to go ahead and have you stand up for me. And then can you go ahead and walk to the door and then back? Perfect. Can you sit down? Thank you. So patient cranial nerve 8 is intact. Now I'm going to go ahead, Maria Paula, and go ahead and make my way down onto your face. I'm going to go ahead and inspect your eyes. Do you mind if I touch your eyes really quick?
Sure.
Can I go ahead and, alright, perfect. Patient's conjunctival sac is pink on both sides. There's no discharge or discoloration of the sclera. So now I'm going to go ahead and check Maria Paula for the, can you go ahead and just look directly forward for me? I'm going to go ahead and check to see if you're reactive to light, okay? So just look forward. So go ahead, so pupils are equal, rounded, reactive in accommodation to light. Now I'm going to go ahead and have you stare at my pen and we're going to do the cardinal gazes, okay? So I'm going to go ahead and just have you follow it. Perfect. So cranial nerves 3, 4, and 6 are intact, and cranial nerve 2 was performed earlier using the Snellen chart, and it was also found to be intact. So now I'm going to go ahead and move my way down and look down at your nose. Can you go ahead and can I touch you really quick here in your sinuses? Do you feel any tenderness, any pain? No. I'm going to go ahead. Can you look up for me really quick? I'm going to check out your nose. No mucus drainage, no deviated septum. Now I'm going to go ahead, can you go ahead and close your eyes, Maria Paula? Can you go ahead and smell this for me? What is that?
Alcohol.
And then can you go ahead and close one nostril and breathe? And can you do it for the same side as the other side? Patient has good perfusion rate. Now, Maria Paula, can you go ahead and, I'm going to go ahead and basically inspect your mouth area. Patient has good lips, they are pink, non-cracked. There are no lesions, no sores. Can you go ahead and open your mouth for me? Can you stick out your tongue? Patient's uvula is midline and intact, no sores, no open wounds. Thank you for picking up the tongue. Now can you go ahead and stick out your tongue for me really quick? Can you move it to the side and back to the other side? Then can you go up and down? And can you go in and out? Perfect. Can you look up for me and then swallow? Simultaneously to this, I'm going to go ahead and check to see if there are any palpable masses or any tenderness on the tracheal area. So did you feel any pain or discomfort? Awesome. So now I'm going to go ahead and palpate all of your lymph nodes, okay? So lymph nodes are non-palpable and non-tender. Did you feel any discomfort?
No.
So now I'm going to go ahead and have you close your eyes. Do you feel that?
Yes.
Can you go ahead and smile for me? Can you go ahead and frown for me? Can you go ahead and puff out your lips? And can you shrug your eyebrows? So cranial nerve 7 is intact. And now I'm going to go ahead and check for cranial nerve 5. Basically check it. Can you go ahead and open and close? No clicking noticeable, so the patient does not have TMJ. Okay, about that, now I'm going to go ahead and basically check to see if you can push up against both of my hands, okay?
Okay.
Push up. So patient, and look over to the other side, and then look over to this side. Patient has cranial nerve 11 intact. What I'm going to go ahead and do now is basically check your carotid, and I'm going to check this unilaterally, okay? Now I'm going to cross-check the carotid with the apical pulse. Patient carotid pulse and apical pulse are equal in rates. Can you go ahead and just look over that way? Can you look back the other way on the other side? Patient has no JVD noted. Now I'm going to go ahead and listen to your carotid artery, Basically, I'm going to be doing, so this is to see if I have any bruits, okay? No audible bruits heard. Next, can you go ahead and sit up for me? And now I'm going to go ahead and listen to your breath sounds, okay? Now, prior to me auscultating breath sounds, I was checking the patient's respiration rates. Chest is rising and falling at equal rates. So can you go ahead and breathe in? Breathe out. Breathe in. Breathe out. Breathe in. Do it again. You can go ahead and breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. Perfect. Now I'm going to go ahead and listen to your cardiovascular sounds. So first I'm going to start over at the aortic. Then I'm going to jump over to the pulmonic. Jump down to Erb's point. Listen to the tricuspid. And then listen to the mitral. Normal cardiovascular sounds heard. Next, I'm going to go ahead and inspect. The patient's upper extremities. Can you go ahead and lift up your arms like that for me? Can you go ahead and push up? Can you push down? Can you push open? Can you push close? Patient has range of motion 5 out of 5. Can I see your fingernails, Paula? Patient has cap refill +2 on all 10 digits. Patient's skin is intact. There are no open wounds. Hair distribution is equal, bilateral. Now I'm going to go ahead and check your radial pulse and your brachial pulse, okay? I'm going to check these both bilaterally. Perfect. So now I'm going to go ahead and I'm going to go ahead and expose your clavicle area really quick, okay? And I'm just going to pinch you really quick. It's just to see if you, this is what we call the skin turgor test, okay? So it's just to see if your skin bounces back, and it does. Skin bounce back normally. Now I'm going to go ahead and check to see the patient's temperature. She's cool to touch the skin. Maria Bella, I'm going to have you lay down for me next, please. And now I'm going to go ahead and inspect the patient's abdomen area. Maria Bella, I'm going to go ahead and expose your abdomen. Is that okay? So I'm going to look at patient's abdomen. Abdomen is flat, non-tender. There's no wounds, open wounds, no visible wounds, no rashes, no lesions, no hives or any sort. So what I'm going to do is I'm going to go ahead and auscultate and listen to your bowel sounds, okay? It might be a little cold, so just bear with me. I'm going to start listening in the right lower quadrant, then move up to the right upper, scoot over to the left upper, and then right down to the left lower. Bowel sounds normal. Then I'm going to go ahead and palpate the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant, and then I'm going to follow that by percussing it. Again, following the right lower, right upper, left lower. Did you feel any tenderness or any pain through any of those quadrants, Maria Paula? Awesome. Okay, now I'm going to go ahead and ask you some personal questions. When was your last bowel movement?
3 hours ago.
Okay, and was it any different from any of the other bowel movements? Was there any difference in color? Any difference in odor? Perfect, so normal bowel sounds, normal movements. Okay, Maria Paula, so now what I'm going to have you do is sit up for me real quick. Perfect, and now I'm going to go ahead and, can you go ahead and basically do this with both your hands? And then can you go ahead and grab your heel and go down to your shin, just like that. Can you do it on the other foot? Perfect, so patient cerebellar function is intact. Upper cerebellar function is intact. Now I'm going to go ahead and have you, can you pick up your legs for me? Can you push up? Can you push down? Can you open up? Can you close? Patient has range of motion 5 out of 5 in the lower extremities. I'm going to go ahead and basically feel for the dorsalis pedis pulse. I'm going to check this pulse bilaterally. And then I'm going to check for the posterior tibialis. And also check this bilaterally. Patient's skin is intact. There's equal hair distribution. There are no rashes, no open wounds or scars to note. Next, I'm going to go ahead and check basically all of her 10 digits, again to check for cap refill. Patient has cap refill +2 on all 10 digits. And lastly, what I'm going to go ahead and do later is I'm going to check both your deep tendon reflexes on your arms and on your legs, okay? I'm going to start over here. Let's go check down here. Patient has deep tendon reflexes intact. Okay, now I think that concludes my assessment, Maria Paula. So I'm going to go ahead and ask you, do you feel safe today? Do you have any idea,
No.
do you want to harm yourself? Do you want to harm anyone else?
No.